Hey out there, this is Dr. Paul Martin with Brilliant Life Chiropractic, and I was meeting with my men's group the other night, and one of the things that came up that we talked about was sort of pregnancy in general, and kind of what a tragedy that it is in this country right now. And pregnancy is treated more like a disease by the medical professions, requiring surgery, sometimes hospitalization. And there are times, I have to admit, there are times when we need those things. When pregnancy and the delivery of a baby, mostly, when the delivery of a baby in labor goes south, and C-section is totally necessary. But that is not the norm, and it is becoming the norm in this country. And there's a lot of things that we can do about that, and a lot of things that we can do about that with regard to chiropractic care. Chiropractic care can be, and dare I say should be, a vital part of every woman's journey through labor, especially if they're interested in having a natural labor and delivery. Why is that? There's a number of things that change as women go through pregnancy, and they can make the spine more vulnerable, making chiropractic care even more important for a pregnant woman than even just your normal situation. The hormone production that goes on during pregnancy, which allows for birth to take place, makes all the joints a little bit less stable. It's called relaxin, and it allows the pelvis to sort of to open up, making room for baby's head. But it makes all the joints a little bit less stable, including the joints in the spine, which can compromise that structure. There's a weight gain that occurs with pregnancy. Typical weight gain is between 25 and 35 pounds. And that extra stress goes into the lumbar spine and creates a little bit more of a curve, makes the muscles have to work harder, and combine that with the relaxin and makes things a little bit harder and increased incidence of back pain. All of that creates an increased postural strain, along with the changing of the center of gravity, because the belly will do this, and then the spine moves, and center of gravity changes. On top of that, we've created in our society with our medical practices regarding pregnancy as a disease, a cascade of interventions that take place that make it so that a natural delivery is becoming less common. Not least of which, just starting with the due date. The fact that we put this pressure on women and we just say, "Oh, this is the due date." Please bear in mind that the due date is a guess. It's a pretty well educated guess, but it's a guess. And it's more of a due month. 2 weeks before, 2 weeks after, totally okay and normal in most circumstances. With my wife and I, and the birth of our daughter, Kira, she was born at 42 weeks and 3 days. And that was great for her. She wasn't too big. She didn't grow too much. 7 pounds, 2 ounces. So, sometimes that is totally fine. But it can create a lot of stress. Creates more stress around that date, especially as you get closer. And then there's the recurrent ultrasounds looking for issues. And what happens if you see a little artifact, but then you want to check it again in 2 weeks? Now you've got 2 weeks of added stress hormone that just makes the whole thing more stressful for both mom and baby, and it's not really necessary. Then you get this adrenaline rush to the hospital when you actually get into that period of labor and delivery. And that can stall things too. The whole labor and delivery process is a parasympathetic nerve system function. Parasympathetic is all about resting. It's all about being at ease. It's all about relaxation. As soon as you induce stress and you get adrenaline and cortisol going, it stops that process. And so that rush to the hospital will actually stall labor. It does. And then you're in this unnatural setting where you're not used to being, and even that can slow down labor. And so when labor gets stalled in the hospital, they call for Pitocin. Pitocin, there's a natural hormone called oxytocin. And oxytocin causes cervical contractions, uterine contractions, cervical dilation, all of which very naturally allows birth to take place and creates bonding with the baby. And we have an artificial one called Pitocin that we use for induction to get things moving. But Pitocin hurts more than oxytocin. Pitocin does not feel good, and so when they're in that much pain and don't progress as well, and it affects the baby as well, then we call for an epidural. An epidural can take away the pain, but then makes it so that mom can't assist with labor as well. So all of these interventions, it's just one after another, just leading down this row of dominoes, basically, make it so that now we're in emergency C-section land because it's failure to progress. They oftentimes also don't give enough time in the hospital for labor to fully develop. With our son, you're talking about a 30-hour labor. In a hospital, we probably would have been heading towards C-section, but we had a totally natural, normal birth at home. It's totally possible. C-sections are sometimes necessary, and, thank goodness we have medicine for when they are and things go south, but the World Health Organization recommends a C-section rate of around 10 to 12%. And in the U.S., the C-section rate is in the 30s. It's about 33% last I saw. Now, chiropractic does several things to help along the way. For one, this philosophy about birth being a natural, normal process can reduce stress on the mom and the baby, and that makes it more likely for a normal, healthy birth. The adjustment itself reduces interference to the mother's nerve system, which controls and coordinates all of her systems and functions, providing a healthy environment for her and for the baby. It prepares the pelvis for an easier pregnancy and birth, creating a state of balance in those bony structures and allowing for the greatest ease during the labor and delivery process. Removing tension in the ligaments supporting that can allow the baby to get into the most optimal position. And so by improving maternal function, we're decreasing the potential for any unnecessary intervention. For the baby, reducing interference to the mom's nerve system will allow for better baby development because of the space and the nerve system and the nutrients that come through the placenta, also innervated by nerves. And then pelvic balance allows the greater room for the baby to get into whatever position it needs to get into. And then with the proper fetal positioning, by allowing that uterine space, by allowing pelvic space, there's a significant decrease in dystocia, which is failure to progress in labor, and any resulting birth trauma that can occur because of these interventions, including C-sections. And of course, you should have babies checked too, but I'll talk about that another time. Stay tuned. This is part 1. I'm going to do 3 parts on pregnancy and chiropractic. I probably should have said it at the beginning, but there you go. Remember, you deserve a brilliant life. Let it shine, and let your baby's brilliant life shine as well. If you're pregnant or thinking about getting pregnant, I would highly consider getting chiropractic care, especially if what you're interested in is a normal, natural birth. But even if you're not, it's the healthiest thing for you and for the baby. All right, take care. Have a good one.